hyperlinked text throughout the presentation. It'll be fonts with an underline. You can click on those for more information on those particular topics offline. And also, if you have any questions following the presentation that we can't answer now or you didn't have an opportunity to ask during the session, please feel free to send me an email or give me a call. You'll have my contact information in the slides, and I'll be happy to provide an answer to you as quickly as possible. So with that, I'm trying to move the slides aren't moving. Hello?
I hear you, Gabe.
Yeah. All right. There must be some sort of technical issue with the slides. I apologize for that. On today's webinar, I think there's a couple of interesting points or important points that statistics that we should mention and why this is a particularly important webinar. The first is that 95% of viral hepatitis outbreaks happen in healthcare facilities that are outside of the hospital setting. So this basically means the doctor's offices, dentist offices, and health clinics, things of that sort. And so for those of you that work in those particular environments, this would be a particularly important issue and program for your facility to implement to reduce those exposure points. And then the other important statistic is that according to OSHA, there's approximately 400,000 needle stick exposures in the United States every year. And we have some statistics a little bit later about transmission rates and so forth, but that's a very high number, and there's some techniques that can be employed by clinicians and dentists, hygienists, and so on and so forth to reduce those risks. So we'll get a little bit into that. And the whole purpose behind compliance and reducing risk in the workplace is to obviously reduce the overall risk of exposure and injury, and the safety and health of those that work there, and as well as the patient. And there's three basic steps. First is obviously identify the risks, conduct a risk assessment within the office, and then to establish a set of priorities and programs that are around those risks so that they could be implemented and mitigated. And then obviously third and lastly is training for the employees that could potentially be exposed to bloodborne pathogens or any other hazard for that matter, and to reduce the overall likelihood and severity of an injury. And the data shows that training is one of, if not the most effective means of reducing risk in the workplace. So with that, in today's webinar, we will be covering three areas. First is an overview